माई सेल्फ एंड माई बैचमेट, हम दोनों ने डिसाइड किया कि अभी एग्जाम होंगे, उसके बाद इसको पीटेंगे। तो वी एक्चुअली मेड इट अ डिसीजन कि इसको पीटना है, तो उसके बाद जो होगा देखा जाएगा, इसको एक बार पीटना है, अपना फ्रस्ट्रेशन निकालना
Hello
है।
everyone, I welcome you back to the channel. So today we have with us a very special guest, and it's an honor to have him here with us. We have with us Dr. Sandeep Sharma, sir, who I guess you all must be knowing very well. Sir has been actively involved in pediatrics teaching, as well as he is a great pediatrician over more than 15 years. We welcome you, sir, on this platform, and we are very privileged to have you with us here.
Thank you, Dr. Akshat. It's all my pleasure to be here and to connect with the audience. And it's really a pleasure on my behalf as well.
Thank you, sir. So, sir, we will actively be talking about, in general, a life of a doctor, because you are since practicing from more than past 15 years. So it will be great insights to all the junior minds who are aspiring to be, someday a great doctor and making a change in the society. So we will talk in detail about sir's clinical practice and overall life journey, as well as we will gain some insights on NEET PG preparation, as well as if someone who is a resident watching this will also gain some insight on NEET SS preparation, as sir has also been an educator for NEET SS examination. So, sir, our first question would be that as a doctor and educator for past 15 plus years, how was your journey and what would be the insights that junior could derive from your life?
See, I'll be honest, it has not been easy, but at the same time, it's like a roller coaster, and I'm enjoying every moment of it. So I think I feel that if you enjoy whatever you are doing, it's all worth it. I started off as trying to be a pediatrician, trying to be a specialist, and I always wanted to be into private practice. But teaching was something which I used to like. Like I used to teach my fellow students, fellow roommates during
Right.
MBBS. Then I used to teach when I was an intern, I used to teach final year students at that time. Then PG time also I used to teach. So I realized that I liked it, but I never really thought about it that I'll be going into the educator mode as a professional.
Right.
Once I started my practice after my MD, then some opportunities opened up. I happened to meet the right kind of people, and I got some, ways to connect with the people, and I thought, why not?
Right.
So end of the day, see, it's like a compromise. One cannot be a completely once you try to be a practicing doctor as well as an educator, I think there are a few compromises which have to be made. Like, for example, I cannot now, because I'm traveling a lot, I'm teaching a lot, so I cannot admit any emergency patients with me. So my practice is purely OPD based.
Right.
So this is one compromise on the practice side which I had to make. On the other hand, if I'm an educator, I cannot be that active on social media, and sometimes students do complain, sir, aapko query pucha, you haven't replied to it. So because I'm practicing also and I have a family time also I have to give, so then sometimes it becomes a bit tricky. But as far as possible, when I'm teaching, I'm not doing anything else. When I am seeing a patient, I'm seeing the patient, I'm not doing anything else. I think that compartmentalization I have developed over the time. It's still a process, it's still in process, but I think with time we learn to do better.
Right. I think that's an amazing insight, sir. In general, doctors as well as medical students who are right now watching this, we all are, suffering from a notion कि doctors का maybe social life इतना अच्छा नहीं होता या, they can't do more things apart from their profession. But at the same time, it's very important that आपको जो passionate है आप जिस चीजों को लेके, and some things which give you joy, as well as this is something like teaching will also give you a learning in itself. So I think that's a great way to balance out things. So, sir, how do you feel, that, like you said, it becomes hectic to manage sometimes both of these things? So, at some point, do you wish कि यार एक ही चीज कर रहे होते हैं, या maybe मतलब whatever, if ये कर रहे होते तो differently होता? So, how do you manage that feeling कि ना हम जो कर रहे हैं वो सही है कि नहीं, या maybe we are doing it the wrong way or something like that?
Honestly, Dr. Akshat, I would say कि कभी-कभी ऐसा लगता है when it gets too hectic and you have already commitments to fulfill, you feel like, yaar, why am I doing this? But end of the day, we are all professionals, right? Whether you are an educator or you are a practicing doctor, you are a professional, and if you have a professional commitment, you have to do it. What makes this easy is two things. Number one, obviously, you're getting paid for it. So anybody who's an educator or anybody who's teaching, treating a patient, yes, there is compassion involved, there is passion involved, but end of the day, you are getting paid for it. both the things are paying my bills.
Right.
So I don't have a big bank balance, ancestral property or anything. So my
Right.
bills are being paid by it. So it is a sense of responsibility also.
Right.
Second thing, I like doing both of the things. I like to see my patient and treat them. I like to teach.
Right.
So if you are doing what you like to do and you are getting paid for it, I think apart from occasional instances, it is usually a good journey. You feel like, okay, you are doing something good.
Right. Right. I think that's a really, practical factor also that we get in this particular situation. That at the end of the day, you have to also, make your course work very well, and that's how we do it. Thank you so much, sir. That was great for us to learn. So now, how does a day in your life look like? What is your schedule and hobbies? And on weekends, is it some lighter way, or on weekends you have classes, so it becomes more hectic? How is it?
See, my days are no 2 days are similar. Normally, my weekends are more hectic because I have recordings to do, or I'm traveling and taking classes, or I have. But in between, if there is a social occasion or alternate Sundays, I usually try to spend time with my family. I get up late. I try to be make it as normal Sunday as possible. I try to take a delayed bath. Then going shopping with the family, just probably a lunch or a dinner in the evening, lazing around, talking to friends, catching up with people, looking at my social media, replying to messages, and then watching some movies. So I try to create alternate Sundays like that. Apart from that, the alternate Sundays and Saturdays, usually there is a class or there is a recording, because I also have super specialty course also running along with the PG thing. So that continuous recordings have to be done. Apart from that, the usual days, it's like first half of my day, usually it is OPD. Second half of the day, usually I keep for either appointment based OPDs, or it is like taking a live session, recording, reading something. In between, when I get time, like what I always advise, I keep 15 to 20 minutes per day for myself, strictly.
Right.
Unless there is an exigency, 15 मिनट अपने लिए, वो 15 मिनट every person should do what they want to do. मेरा जैसे आपने हॉबी पूछा, I like to watch movies. I like action movies, so I watch them sometimes. पूरा नहीं देख पाता हूँ, but at least a part of it. So it's like a series. A movie is a series for me.
Right.
Sometimes I do like to. I like to read mythology, and I like to read philosophy. I also like to write blogs, etc. But I don't write in my own name. So those kind of things which I do. उसका कोई मॉनेटरी वो नहीं है, बट इट जस्ट कीप्स मी सेन, इट जस्ट कीप्स यू गोइंग कि हाँ यार आप ठीक कर रहे हो. एंड व्हेन आई एम ट्रैवलिंग और गोइंग समवेयर, आई ऑलवेज हैव माय ईयरपॉड्स विद मी, सो आई एम ऑलवेज लिसनिंग टू म्यूजिक.
Right.
सो अगेन दैट्स अ गुड स्ट्रेस बस्टर.
Right. Right.
एंड हॉलीडे का मतलब होता है आई विल नॉट डू एनीथिंग, आई विल नॉट गो आउट ऑफ माई रूम, मैं वहीं पड़ा रहूंगा. नो वो ये मेरे पास नॉवल होगा, बुक होगा, जो भी मुझे पढ़ना है वो पढ़ूंगा, खाऊंगा, सोऊंगा, फिर
Right.
खाऊंगा, सोऊंगा, पढ़ूंगा. That is the cycle which I do. So I think it is quite boring from somebody else's perspective, but that is refreshing for me.
Right, right, right. I think that's great when you work relentlessly 24/7. So doing nothing is the best, stress buster that can ever be. So that was great, sir. So now going back to your, UG student life. So how was your, UG life, and you were the studious ones or the relaxed ones, or the students who are balancing both of these things?
See, in my UG, seen me, I was very different from what I am today. I was a backbencher. My attendance was always short. I was attending classes, attending clinics, but I was, very laid back.
Right.
After every prof, I would pass. But I was never, my batch was a very small batch. It was 70 students only. So in 70, I was never in top 5. I
Right.
was passing, but I was never in top 5. Top 15, I was there. But one small little thing was, I was very clear that once the entrance exams come, I have to prepare for them. And so from second year onwards, I was reading Harrison. So
Right.
Harrison was something which I would always make it a point to at least uh, 15 minutes a day, 20 minutes a day, just like people read Harry Potter.
Right.
I would read Harrison at that. And I think that was a good practice, which stayed with me till now. So even now it's not Harrison, it's Nelson. So
Right.
whenever I do get time, 10, 15 minutes, I just try to, scroll the pages and see uh, it helps you keep refreshed from academic point of view. Students are very difficult these days. Students
Right,
will be like, sir, आपने वो ऐसा बताया 0.5 था, वो तो 0.6 लिखा है. So
right,
being a teacher is a sense of responsibility also, and you need to be on your toes as well. So it's a good thing, I think. So
right.
MBBS, I was very chilled out. I would attend all these festivals. I would travel a lot. I would only barely be able to manage the things, but my eyes on the goal was there ki ha, once the exams come, I have to pass them. So that fact I did not let go.
Right. So I think this is a very great message that, it's a long journey, so you should have eyes on your goal. But at the same time, it's very important to, enjoy the journey as well. So please don't burden yourself with all those things that you want to do. It will happen with time. So now, like you said, sir, that you studied, Harrison every day. So now today, if we talk, it's an era of app-based teaching, right? Every app, many apps are there for, PG preparation. And like you started in second year Harrison, today students are starting even in first year. So how would you compare this, or maybe the importance of reading standard textbooks even now in this era?
See, I would say that this advent of app-based teaching, when I was preparing, there were no app-based teaching. Coachings were there. There
Right,
was DAMS, there was Bhatia, there was another institute called as IEMS, and
right,
then there used to be a South-based institute called as Speed. So
okay,
these were the four options, only four options available, and there was nothing online. It was all offline. You were supposed to attend classes or maybe take breaks in between. And then you had the usual textbooks. The same people who are now superstars in the app world, they used to write MCQ books at that time. So I've read those books at that time. So, but app-based teaching, I personally feel that it has been a good addition for the students. It is a good addition because it gives you a flexibility कि आप जब पढ़ना चाहो आप पढ़ो. Secondly, a lot of subjects, the way they are taught in medical colleges, I'll be honest, I have been a part of a government college. I have been part of PGI. For a few brief period of time, I have worked, I have attended AIMS, and I've also worked in a private medical college. Uniformly, I would say there are some exceptions in departments, but uniformly, the medical teaching which is there, it is not appropriate enough. It is not good enough for either cracking the exam or for having that extra edge for the patients.
right, right,
Yes, clinical bedside teaching is excellent in medical colleges, many medical colleges, I would say, but the knowledge that you get is good, not good enough. You need to prepare something extra for the competitive exams. So these app-based things which have come up, they have actually made the life easy for a lot of medical students. There is one problem with that because everything is now available on a platter. We now have a problem of plenty. Now, what people do is they will be like one of my close family members, a student, he's preparing for NEET PG. He has my, like I work in Dr. Tutorials, I have NEET PG there. So he has Dr. Tutorials, my content. He's following Marrow. He's following Prep Ladder. He's
hmm,
also has, access of notes or attending classes of another pediatric faculty also. So four pediatric materials he has. And then he asked me, Bhaiya ho nahi raha. So then I have to tell him, bhai, ek kyun na hai? So
right,
we have a problem of plenty. Many of the students, what they end up doing is trying to overdo certain things and they get up totally ignoring certain things, which actually harms them in the exam.
right,
So you need to be consistent. Number one, you need to be strict with yourself and do not try to run after too many sources. Whatever source you are following, I think you should be doing it properly. And lastly, we all, because of these online apps, one problem is many of us are not attending the clinics and
right.
we are losing out on the patient interaction, history taking, examination. Karnik sign Brzezinski right now in PGI third year, preparing for super speciality. He confided in me. He met me in Chandigarh for some other personal work, and he told me very clearly, सर मुझे सेकंड ईयर में जाकर गाली खाने के बाद कर्निक साइन करना आया. यू इमेजिन द पर्सन हु इज अ टॉप 10 रैंकर इन अ सेंट्रल इंस्टीट्यूट, उसको, और वो अपने यूनिवर्सिटी टॉपर है और उसको कर्निक साइन करना नहीं आता है, विच इज अ सैड थिंग दीस डेज.
Right.
सो माय एडवाइस टू ऑल दोस पीपल इज, आपको ऐप का एक्सेस मिला है, मेक गुड यूज ऑफ इट. Be grateful that you have got that access. Yes, money is involved in it, but at least spending money, you are getting a lot of content. But at the same time, there is no alternative to attending clinics, performing the science and seeing on the bedside. And that is why internship, I feel, is very, very important.
Right.
So ये थोड़ा सा जो balance है, I think that balance needs to be struck somewhere.
Right. I think that was a really, concise answer to what scenario currently is and how you can derive the best of it. So, sir, like you said that you have you've done your PG from PGI Chandigarh. So, how was your time there, and what made you decide pediatrics as a career option?
See, PGI Chandigarh, I had one of the toughest times of my life in PGI Chandigarh for the simple reason pediatrics is not an easy branch, and PGI, yes, you can call it as toxic at that time. It is not toxic as of now, but it used to be very toxic. Toxic in the sense you had a lot of pressures. You are coming from a place जहाँ पर आप attendance भी short है, तो कभी कभी काम कर रहे हो. You are passing the exam here. If your duty ends at 12 hours, it officially ends at 12 hours, but till you have given the handovers and all the things which you have written, they have been taken care of, you cannot really leave. And if you have a seminar in the morning, because you have got free at 3 a.m. does not mean कि 7 a.m. का जो presentation है, somebody will be going easy on you. You have to present it. So those pressures were very there. See, I'll be honest, मुझे PGI में नहीं आना था.
Right.
जब मैं तैयारी कर रहा था, so I belong to Chandigarh and I done my MBBS from IGMC Shimla. So I was like कि I had been a hostler, so मुझे था कि यार वापस घर जाकर day scholar कौन बनेगा. And secondly, I had heard that PGI is very demanding, very tough. So I was actually preparing for AIMS entrance exam. But as destiny would have it, my top rank was in PGI. AIMS, I was getting pediatrics. I was getting other clinical branches. So the decision was very clear. My dad actually asked me, "You want to take another chance?" I was like, "नहीं." सबको पता होता है ये आपका पीक है. So it's like somebody winning a World Cup and retiring from there. So I said, "Okay, PGI join करता हूँ." So first few weeks were very tough. In between also there were instances where I would feel like, why have I joined there? What am I doing with my life? 36 hours duty you become like a total mechanic, you become like a robot. But over the time you start learning, you start liking the subject. और आज अगर मैं देखता हूँ, if I look back, whatever I am today, it's because of the place which made me. Yes, the place could have been and should be a bit more lenient on people, because most of us are young people coming from medical colleges. We are from a very protected environment, तो थोड़ा सा light होना जरूरी है. But at the same time, I think the skills which I learned at PGI, they have made me what I am.
Right. So I think that's really great that when you look back, those days come back very nicely to you. So a bit of stance on, like, you take NEET SS preparation for all the seniors. So basically, NEET SS after pediatrics. So basically, two things we would like to know: that how do you feel is, like, pediatrics, usually people used to say that it's a terminal branch. Malab, nowadays there's always a scope of DM more often. So how would you first think that in sense of terminal branch and all? And second is NEET, regarding NEET SS preparation, if there are some residents, so what will be your message to them?
See, my message is very clear. When I took MD Pediatrics, at that time, pediatrics was a relatively terminal branch.
Right.
It was still relative at that time. It means you had the option, you can go into general pediatrics or you can go into super specialization. As I talk about now, people who are entering into pediatrics, they should be clear in their mind that pediatrics is no longer a terminal branch. There are specialties available, and even if you don't take up a specialty, you need to do a fellowship or develop an area of interest in which you will be working again and again and developing an expertise in that. Pediatrics, see, if you want to settle in Delhi, Mumbai, Kolkata, Hyderabad, Bengaluru, or Chennai, be clear, MD Pediatrics is not going to be enough, and you will have to struggle a lot. There will always be exceptions. There will always be people with running setup or with a good hold in some corporate setting, so you can easily join there. But 90% of them are going to have a tough time in the first 3 or 4 years, because MD Pediatrics, you will not have good employment opportunities apart from senior residency or maybe registrarship in a few corporate settings. You will not get to be a consultant that easily. Apart, if you want to settle in a smaller town, like my native place where I was born is Ambala. So
Right.
if I'm an MD Pediatrics today and I go back and I open a clinic in Ambala, 1 year or 2 years it will take, but after that I would have a thriving practice. So the place you are going to practice, it should be clear in your mind. and whether you take it as an end branch or as a relatively, a non-end branch, that decision will be according to where you want to settle. Secondly, when you're taking pediatrics, there are a lot of scope these days, lot of DMs, almost as I can recall, 16 DMs in pediatric branches are available, starting from neonatology to pediatric critical care to pediatric rheumatology, pediatric gastro, pediatric endo, and so on. One should be aiming for something in which they have interest, number one. Number two, it should be a branch which is procedure based, because procedure based branches में हमेशा earning ज़्यादा होता है. And thirdly, it should be a branch where not many people are doing it. For example, somebody wants to do active procedures but work in a private setting. तो उसके लिए pediatric gastro is good, but pediatric critical care is not, because pediatric critical care you need to work in an institution. You cannot do a private practice.
Right.
Pediatric gastro, you can only do endoscopies and you can have a very good, earning potential. On the other hand, you don't want to do night duties, but do something in which you have a very strong, thriving OPD, and people from all over the country are coming to you. Go for DM pediatric endocrinology. Chandigarh itself, there is no single DM pediatric endocrinologist who's working.
Right.
All the adults are there, or fellowship people are there. So you will be the first one. It will take some time, but you will have a strong, thriving practice. So you need to be clear, and for that you need to crack entrance exam. We have NEET SS, we have INISS. The exams are MCQ oriented, and the pattern, the paper is entirely based upon what you learn over the 3 years. And there is a textbook called as Nelson textbook, 80% paper, both NEET SS and INISS comes from there. Apart from that, the protocols are there. So, but you need to, start preparing, I would say, from the second year onwards. Seriously, if you want to crack within one go, or you can start from the third year and maybe take a 6 months break, consolidate the things, and then crack the entrance exam. But first year, when you join MD or DNB in pediatrics, focus on learning the skills, learning the patient, and not run after, blindly after these books and MCQs. Because end of the day, एक टाइम आएगा जब आपको पेशेंट को ठीक करना है, एमसीक्यू सॉल्व नहीं करना है.
Right.
और एमसीक्यू सॉल्विंग स्किल और पेशेंट ठीक करना अलग अलग चीज होता है. सो दिस ट्रांजिशन हैज टू कम, सो दैट ट्रांजिशन नीड्स टू कम ड्यूरिंग योर पोस्ट ग्रेजुएशन. Yes.
Right. So I think that was really a great answer, sir. So now, on the similar note, since you gave an advice for NEET SS preparation, one particular advice that you would like to give to all the MBBS students watching this, because majorly the crowd is also of first, second, third year, so they also want to know that how they should go about, and something for NEET PG aspirants.
ठीक है, so MBBS से start करते हैं. First of all, MBBS वाले जो लोग हैं, see, if you are not topping your exams, it is absolutely fine. You can still get into a central institute or into a top medical college, because आपका जो कॉलेज का जो यूनिवर्सिटी एग्जाम होता है और जो एक्चुअल एंट्रेंस एग्जाम होता है, there is a big gap between them. What I am trying to say is your eyes should be on the longer term goal. At the same time, जहां पर हैं उसको भी करना जरूरी है. So whenever you are attending your clinics, be sincere, try to see the patient, and try to read and correlate with whatever you are reading or whatever you are, listening to the videos in whatever app you have prescribed. End of the day, people often ask me, sir, 8 घंटे रोज पढ़ूं 3 साल तक, तो क्या पहली अटेम्प्ट में निकल जाएगा? आप 8 घंटे 3 साल तक नहीं पढ़ सकते. नहीं पढ़ सकते हो, कोई भी पढ़ सकता है. एंड आई थिंक एनीबडी हु हैज बीन अ टॉपर, दे वुड से कि जरूरत ही नहीं है. व्हाट यू नीड टू डू इज कंसिस्टेंसी. रोज, जैसे मैंने बोला, 15 मिनट 20 मिनट पढ़ना है, लेजरली जानना है. वीकेंड पे थोड़े से एमसीक्यू सॉल्व कर लिए ताकि आपको आइडिया रहे. जब आप क्लिनिक्स अटेंड कर रहे हो तो क्लिनिकल मैनुअल्स को पढ़ना है, पेशेंट को देखना है, बिकॉज एक क्लिनिकल स्किल जो होता है ना, वो काम आता है एग्जाम के अंदर. बिकॉज अभी रिसेंटली क्वेश्चन भी आया था कि आप एक पेशेंट है, उसको कैनुलेट करना है, तो व्हाट आर द थिंग्स यू विल रिक्वायर. No app in this will be teaching you that. But if you have attended your clinics or seen, on the bedside, you would easily know कि एक फ्लश चाहिए, एक वो फिक्स करने के लिए वो चाहिए, स्पिरिट स्वैप चाहिए, और किस साइज का आपको कैनुला चाहिए. That is all you need to do. So these are the small little things. They will be helpful in MCQs also. So don't be a robot of only solving MCQ, याद किए जा रहे हैं. Second thing I would advise is, if you are a MBBS student, every institute, including the ones where I am working on, they also have their quick revision or rapid revision program. वो MBBS करते हुए नहीं पढ़ने हैं, क्योंकि आपको अगर शॉर्टकट का भी आदत पड़ जाएगा, वो आपको फ्यूचर में हार्म करेगा. रीड स्टैंडर्ड बुक्स, read, make your concepts. If you are unable to read standard book, हैरिसन नहीं पढ़ा जा रहा, रॉबिन्स नहीं पढ़ा जा रहा, it is absolutely fine. जो आपके टीचर्स हैं, आपके जो ऐप्स हैं, सब ऐप वाले बहुत अच्छे हैं, मेरे कलीग्स हैं, सबको जानता हूं मैं पर्सनली, बहुत अच्छा पढ़ा रहे हैं, उनकी बात सुन लो, बट ट्राई टू अंडरस्टैंड द टॉपिक। एंड थर्डली, ये स्टूडेंट लाइफ, एमबीबीएस लाइफ जो है, ये टाइम वापस नहीं आएगा, तो लाइफ को भी एंजॉय करना है, अपने कॉलेज के जो फेस्टिवल्स होंगे उनको भी अटेंड करना है। इफ यू आर हैविंग अ हार्ट ब्रेक, that is absolutely fine, सबके साथ होता है, take it in your stride, tomorrow you will look back and laugh about it. So all these, you know, phases of life we have to live through, लेकिन while living all these phases, the eyes should be on the goal, at the back of your mind, कि यार एग्जाम देना है। मोस्ट लाइकली जो लोग सेकंड थर्ड फोर्थ ईयर में है, यू विल बी सिटिंग फॉर एग्जिट एग्जाम, नेक्स्ट एग्जाम आएगा, तो क्लिनिकल एक्यूमन होगा, प्रैक्टिकल क्वेश्चंस आएंगे, आपसे पूछा जाएगा, पेशेंट रेस्ड क्वेश्चंस आएंगे। सो क्लियर योर कंसेप्ट्स, अटेंड क्लिनिक्स वेल, एंड थोड़ा थोड़ा स्टैंडर्ड बुक पढ़ते रहेंगे, तो स्मॉल लिटिल थिंग्स आर गोइंग टू एड अप टू समथिंग बिग। सो दिस इज फॉर दोज हु आर इन doing their MBBS right now. As for people who are in internship, आपके पास बहुत limited time है. Now try to concise the preparation. Follow one source. Do it 3 times. Doing pediatrics from one source, even if you don't like my video, absolutely fine. जिसको भी आप फॉलो कर रहे हैं, 3 बार उनका वीडियो करना इज मच बेटर देन रीडिंग पीडियाट्रिक फ्रॉम 3 sources एंड नॉट रिवाइजिंग इट। इट इज द नंबर ऑफ रिवीजन जो आपको हेल्प करेगा। इफ यू आर एबल टू डू 2 or 3 रिवीजन, इट इज गोइंग टू बी वंडरफुल। शॉर्टकट्स, शॉर्ट रिवीजन प्रोग्राम्स सिर्फ लास्ट क्लोज टू द एग्जाम करने हैं, उससे पहले करने की कोशिश करेंगे, वो आपको हार्म करेगा। अभी आपको शायद रियलाइज नहीं होगा, बहुत सारे लोग भी आपको एडवाइस करेंगे, बट एट मेरे अपने रिवीजन प्रोग्राम्स है शॉर्ट वाले, बट आई वुड एडवाइज अगर टाइम है तो प्रॉपरली पढ़ो, समझो डिजीज को, एंड वट एवर यू अंडरस्टैंड, solving MCQs becomes much easier, and revision actually becomes much easier once the time comes, once last 6 months or 3 months come for you.
Right,
So
right.
that's from my end.
I think that's really great, sir. And you know, the insights are very powerful. So I think we are going towards the completion of the interview. So one, you know, on a small non-academic note, you know, something which is any interesting incident from your UG or PG life, which you want to share. Either it can be something funny or, you know, impart an important message so that audience can also, you know, cool off from this session and they can, you know, take the knowledge back and apply it in their, you know, medical life.
देखो ऐसा है कि आई से एमबीबीएस वाले तो बहुत सारे इंस्टेंसेस है, सम ऑफ देम वुड बी बॉर्डरिंग ऑन embarrassment, so I would not be talking about them, but at the same time during PG also I had some funny instances, and there is a subtle message in that. Like what happened was, as I said, at PG में मुश्किल था, तो we joined as MD. So and this is something people will relate. There are always certain people in certain departments जो बहुत टॉक्सिक होते हैं, जिनका लाइफ बहुत फ्रस्ट्रेटेड है, एंड दे विल ऑलवेज बी पिकिंग यू और टारगेटिंग यू फॉर स्मॉल लिटिल थिंग्स। दैट विल हैपन ड्यूरिंग इंटर्नशिप, एंड दैट विल आल्सो हैपन ड्यूरिंग योर PG life. So
Right.
there was one senior resident, particular senior resident, I will not take the name, obviously he's now a consultant in he was doing his DM in a central institute, I'll say Dr. R. So Dr. R would be like always using foul language, always using, targeting the PGs, and in particular I don't know why, but he would be targeting me and one of my batchmates quite consistently. So if we are reaching at 9:01, they would be writing a letter to the HOD, not coming on time, coming quite late. So इस तरह से लेटर 1 मिनट के डिले की वजह से they would be writing and targeting us, and we will be going, explaining, apologizing, letters, those kind of things were there. So a lot of mental trauma was there. Once it so happened कि हमारे सिर के पानी सिर के ऊपर से निकल गया. So myself and my batchmate, हम दोनों ने डिसाइड किया कि अभी एग्जाम होंगे, उसके बाद इसको पीटेंगे. तो वी एक्चुअली मेड इट अ डिसीजन कि इसको पीटना है, उसके बाद जो होगा देखा जाएगा, इसको एक बार पीटना है, अपना फ्रस्ट्रेशन निकालना है. सो वी बोथ, पीजे में एक जगह है उसको कहते हैं, वो वहां पर कॉफी वगैरह मिलता है, बट वो आया ही नहीं उस दिन, बिल्कुल नहीं आया. एंड देन हमने लेटर ऑन, जो देयर वाज अनदर सीनियर रेजिडेंट जो कि उसका बैचमेट था, ही वाज वेरी नाइस विद अस, तो हमने उसको बोला, सो कि तो ही एक्चुअली चाइल्डेड अस एंड ही वाज लाइक कि तुम लोग क्या कर रहे हो, दिस इज नॉट द वे टू डू इट, एंड once the time comes you would realize how foolish it is, because
Right.
you will be getting into legal, you will all be, and violence is never the answer, and this is a phase which everyone has to pass through. And that was a learning phase for us. We understood that it was not right, and it was, that immaturity on our part, and we all, I don't know about others, but I developed a rhino skin at that time. मतलब गैंडे का चमड़ी बना लिया मैंने, जो बोलना है बोलो, मेरे को बिल्कुल फर्क नहीं पड़ता है, मुझे अपना काम करना है, और मैंने MD करने के बाद तुम में से किसी की शक्ल देखनी नहीं.
Right.
So I followed that principle. whenever he would be shouting at me or anybody, I would be imagining in my mind there is a dog who's barking. So
Right.
actually we started associating with that person with a barking dog. So eventually what happened was हम लोगों का MD हो गया, पास हो गए. कुछ सालों के बाद I met that same person who's now a consultant in a medical college at airport while traveling. And we sat down, हम दोनों same flight में थे, we sat down and I confided in him and I said कि सर आपको पता है कि we had actually made a plan of actually beating you. And he said, मुझे पता था, मैंने तुम्हारा बात सुन लिया था. And that is why I did not turn up that day. And I had
Oh,
also decided कि अगर ऐसा कुछ होगा, I will be writing a letter to the dean and all. So then we both laughed at it and we were like, we were so immature. So it's a phase which comes into it. And today, when I look back, I have very good relations with him. Whenever I attend a conference in South, I always meet up with that person. And he's a very jovial person. But he said, later on, he confided two things. He said he was having a lot of turbulence in his life, personal life at that time. And secondly, he used to be a very sincere person. And he said कि मेरे department में जब मैंने join किया, people used to bully me saying you are very soft on your juniors.
right.
So that time I realized that if a person is being toxic with us, maybe that person is toxic by nature, maybe that person is having some issues and he's just reflecting that negativity around. And many times in certain colleges, departments, the so-called toxicity is a part of the institution itself. वहां जाकर आप उस रंग में रंग जाते हो. सो
Right.
हम लोग अगर किसी मेडिकल कॉलेज में है या डिपार्टमेंट में है, इट इज आवर ड्यूटी टू टेक अप. इट इज लाइक अ लाइफ, राइट? आप हर तरह के लोग मिलते हैं, आप लोगों को चेंज नहीं कर सकते हो. यू कैन डिसाइड योर रिएक्शन टुवर्ड्स देम. So our reaction should be whenever you are doing whatever place you are working, absorb good things from that, absorb the skills from that, develop a rhino skin. कोई कुछ भी बोल दे, आपने गाली नहीं देना. नंबर वन, दैट इज वेरी वेरी इंपॉर्टेंट एंड यू वुड रियलाइज द इंपॉर्टेंस ऑफ इट लेटर ऑन. पब्लिकली नहीं देना, घर में जाके जो जितना मर्जी गाली दो.
Right.
एंड सेकेंडली, कभी भी यू शुड नॉट बी इवन थिंकिंग अबाउट दैट पार्ट कि आप उसको पीट देंगे, ये हो जाएगा. बिकॉज दैट इंसिडेंट इज देन गोइंग टू बी लाइक अ डेड एल्बेट्रॉस अराउंड योर नेक. इट इज गोइंग टू बी अराउंड विद यू कि आपका एक रेपुटेशन खराब हो जाएगा. बिकॉज टुमारो यू आर गोइंग टू बी वर्किंग विद द सेम वेरी पीपल. सो
Right.
वो रेपुटेशन जो होता है बहुत इंपॉर्टेंट होता है हमारे फील्ड के अंदर. एंड थर्डली, अगर टॉक्सिसिटी आपके साथ हो रहा है, आप अकेले नहीं हो, वो सबके साथ होता है. यू जस्ट हैव टू पास थ्रू इट. इट्स अ फेज इन लाइफ. आज मैं अगर लुक बैक करता हूँ, आई मेट अ लॉट ऑफ बैड पीपल, सो कॉल्ड बैड पीपल एट दैट टाइम. राइट नाउ इट डजंट मैटर. व्हाट मैटर्स इज कि जिस जगह से मैंने किया, दैट प्लेस हैज गिवन मी द बेस्ट ऑफ ट्रेनिंग राइट नाउ. एंड द पीपल हु आई यूज्ड टू बुली certain people who used to bully me, आज भी हम लोग मिलते हैं आराम से. we meet over we have our beers and we laugh out all these instances which have happened in the past. So it's a phase. Take control of your actions and develop a rhino skin. ये टाइम अगर खराब टाइम चल रहा है, निकल जाएगा. So that is what I can share with you. I've not taken names because then it will be very controversial.
Right.
He's
Right.
a quite popular person in one of the central institutes.
Right. Right.
Senior.
Right, right, right. I think that was something which was very refreshing, but at the same time, both haunting as well, and something which we can learn as well. So I think this was a really great, honest session, sir, and this was something which was very, pure from the heart and very organic as well. So we really thank you for your time, and I think the audience would really be enlightened with this interview because it is an in-depth analysis of everything that goes around your life. And again, thank you so much for your time on this Sunday. And we really wish that, you keep coming back on this channel and, enlighten other juniors.
Pleasure is all mine, Akshay. Thank you so much for connecting with me. So, मेरा first half of the Sunday अभी activate हो गया. Now
Right.
after this, I'm just going to, I'm planning to watch some movie now.
Right. I think that's amazing, sir.
Okay.
Thank you so much.
Yeah.
Stay safe, stay healthy.
Thank you very much.